inclination and angulation of the roots of the teeth. Inclination and angulation of the roots of the teeth. The relationship of the axis of the maxillary and mandibular teeth to each other varies with each tooth group, that is, incisors, canines, premolars, and molars, as illustrated in figure 16.19. Knowing about the relative root angles has several uses. Why you should know about the relative root angles? What are the uses? Let's have a look over the uses. It aids in visualizing how the X-ray beam must be directed to obtain true normal projections of the roots of the teeth. 2. It helps relate the direction of occlusal forces in restorations along the long axis of the teeth. 3. It guides control of orthodontic forces for proper angulations of the teeth. And 4. It aids in using templates. It aids in using templates to place dental implants with the right angulations. These were the uses of knowing the relative root angles. It helps in orthodontics, it helps in implant dentistry, it helps in restorative dentistry, and it helps in oral radiology. Right? No absolute rules may be assumed. No absolute rules may be assumed when describing the axial relations of the maxillary and mandibular teeth in centric occlusion. You can see in the figure 16.20. This is the figure 16.20 picture, that is showing anterior and lateral views of average arrangement of the teeth, showing mean inclination, longitudinal axis of the roots have been extended beyond the crowns and appear in orthognathic projection. And picture B showing orthographic projection, that is OPG, projection of mandibular teeth seen from an anterior and lateral perspective. Root axes are extended beyond the crown. Root axes are extended beyond the crowns. The degree of obliquity of roots represents an average of the skulls examined. Each tooth must be placed at the angle that best withstands the lines of force brought against it during function. The angle at which it is placed depends on the function of the tooth needs to perform. If the tooth is placed at a disadvantage, its longevity may be at risk. Although one of the principles of clinical practice is to direct occlusal forces along the long axis of the teeth. Practical methods for application of that principle clinically by determining such a force vector has yet to be established. Practical methods for application of that principle clinically by determining such a force vector have yet to be established. The anterior teeth, as shown in the figure 14.24 and through 14.26, seems to be placed at a disadvantage when viewed from the mesial or distal aspects. The lines of force during mastication or during the mere opening or closing of the jaws are tangent generally to the long axis of these teeth. You can see in the figure 14.25. It has been suggested that they are designed for momentary biting and shearing only, and not for the assumption of the full force of the jaws. Neuromuscular control mechanisms are highly developed for the control of such transient forces. The mesiodistal and faciolingual axial inclinations. The mesiodistal and faciolingual axial inclinations of the teeth are usually described in terms of the angles between the long axis of the tooth and the line drawn perpendicular to the horizontal plane, that is or to the median plane. Right? The axial inclinations of the teeth and roots vary, but in general they appear to correspond favorably to the data summarized in Box 16.1, which is adapted from Andrews work counts and consistent with the data of Dempster et al. For the roots of teeth illustrated in figure 16.19. This is the box 16.1 showing the angulation or inclination of the teeth. This is the left side is mesiodistal inclination and the right side is faciolingual inclination. Right? The mesiodistal angulation or inclinations for the upper second molar, upper right second molar is 8 degrees. For first molar it is 10 degrees. For second premolar it is 5 degrees. For first premolar it is 9 degrees. For canine it is 17 degrees. For lateral incisor it is 7 degrees. For central incisor it is 2 degrees. Whereas mesiodistal inclination for the lower right second molar it is 14 degrees, and first molar it is 10 degrees. For second premolar 9 degrees, and for first premolar it is 3 degrees, and for first premolar it is 6 degrees. For canine it is 6 degrees. For lateral incisor it is 0 degrees. For central incisor it is 2 degrees. Now faciolingual inclination for the upper left central incisor it is 28 degrees. For lateral incisor it is 26 degrees, and canine 16 degrees. First premolar 5 degrees. Second premolar 6 degrees. First molar 8 degrees. For second molar 10 degrees. And faciolingual inclination of the mandibular left central incisor it is 22 degrees. For lateral incisor 23 degrees. For canine 12 degrees. For first premolar 9 degrees. For second premolar it is 9 degrees. For first molar it is 20 degrees. For second molar it is 20 degrees. Now functional form of the teeth at incisal and occlusal thirds. The incisal and occlusal thirds of the tooth crowns present convex or concave surfaces at all contacting occlusal areas. The incisal and occlusal thirds of the tooth crowns. The incisal and occlusal thirds of the tooth crowns present convex or concave surfaces at all contacting occlusal areas. When the teeth of one jaw come into occlusal contact with their antagonists in the opposite jaw during various mandibular movements, the curved surfaces come into contact with the curved surfaces. These curved surfaces may be convex or concave. A convex surface representing a segment of the occlusal third of one tooth may come into contact with a convex or a concave segment of another tooth. Always, however, curved segments contact curved segments, large or small. You can see in the figure 16.21. This is the figure 16.21 showing the incisal or occlusal thirds of the crowns of the teeth, showing the curves and concave surfaces of all contacting occlusal areas. The posterior lingual surfaces of maxillary incisors present some concave surfaces where convex portions of the incisor ridges of mandibular incisors come into occlusal contact. The posterior teeth show depressions in the depth of sulci and developmental grooves. Nevertheless, the enamel sides of the sulci are formed by convexities that point into the developmental grooves. Cusps that are rather pointed contact the rolls of hard enamel that make up marginal ridges on posterior teeth. Until the cusps are worn flat, the deeper portions of the sulci and grooves act as an escapements for food, because the convex surfaces of opposing teeth are prevented from fitting into them perfectly by the curved sides of the sulci. You can see in the figure 16.22. This is the figure 16.22 showing the maxillary second molar. You can note the rounded cusp tips and ridges and the rounded turned irregular ridge folding into the central fossa and into the mesial and distal fossae. Right? Although the teeth, when in centric occlusion, seem to intercuspate rather closely, on examination it is found that escapements have been provided. These escapement spaces are needed for efficient occlusion during mastication. When occluding surfaces come together, some escapement spaces are so slight that light is scarcely admitted through them. Some escapement spaces are so slight that light is scarcely admitted through them. They vary in degree of opening from such small ones to generous ones of a millimeter or more at the widest points of embrasure. It should not be assumed that the teeth fit snugly together like gears, at least not unless they are worn down severely from abrasive food or bruxism. as can be seen in figure 16.23. In unworn teeth, the rounded surfaces do not mesh. In unworn teeth, the rounded surfaces do not mesh closely together. Right? Escapement. This is the figure 16.23 showing the first molars positioned in simulated contact relations in the intercuspal position. In the left illustration, the teeth are viewed from a right angle. Teeth are viewed from a right angle, which suggests that the mesiobuccal cusp of the maxillary molar fits snugly into the mesiobuccal groove of the mandibular molar. However, in the right illustration, the view of the tipped molars shows that the triangular ridge of the mesiobuccal cusp does not fit tightly into the mesiobuccal groove, and that there are many escapement spaces present. Escapement space is provided in the teeth by the form of the cusps and ridges, the sulci and developmental grooves, and the interdental spaces or embrasures when teeth come together in occlusion. The significance of the incisal and occlusal thirds of the teeth has been an area of controversy because so little objective information is available on the influence of flat or convex surfaces on function. The use of anatomical and non-anatomical occlusal surfaces of the denture teeth has only heightened interest in the role of cuspal form, escapements for food, and cutting surfaces in mastication. An examination of contemporary Eskimo or aboriginal dentitions show that by age 20, most of the teeth are flattened. And it has been suggested that the only advantage of the cusp on the teeth in humans is the establishment of the teeth in their correct position during the development of the occlusion. The only advantage of the cusp on the teeth in humans is the establishment of the teeth in their correct position during the development of occlusion. Although such ideas have little acceptance, some clinicians erroneously grind the posterior teeth flat under the impression that the dental caries as well as some forms of TMJ muscle dysfunction and perhaps periodontal disease may be reduced. Although the evaluation of mastication is an interesting subject, and the persistence of cusps into early middle age has occurred only in Western humans for the last 200 to 300 years. It must be accepted that cusp form and function at this time have to be consistent with the dentition of modern humans. Although the number of concepts of occlusal morphology, that is especially about incisal third or occlusal third, have been suggested for restorations, none has been demonstrated to increase the health and comfort of patients more than another. Facial and lingual relations of each tooth in one arch to its antagonist in the opposing arch in centric occlusion. Let's discuss about this topic. In the intercuspal position, the facial views of the normal dentition show each tooth of one arch in occlusal with the portions of the two others in the opposing arch. You can see in the figure 16.24. That is important point. In the intercuspal position, the facial views of the normal dentition show each tooth of one arch in occlusal with the portions of two others in the opposing arch. See the figure 16.24. Very important point to be noted. This is the figure 16.24. Schematic drawing showing the facial or buccal relations of teeth in opposing arches in an idealized occlusion. That means a tooth in one arch will contact with portions of two teeth in the opposing arch. See also figure 16.20 for better clarification. Figure 16.20. This is the figure 16.20. Same picture. With the exception of mandibular central incisor and the maxillary third molars. With the exception of mandibular central incisor, which contacts with only maxillary central incisor, and the maxillary third molars. It is one of the exceptions, right? Which also contacts with only mandibular third molar. Each of the exceptions named has one antagonist only in the opposing jaw. For example, mandibular central incisor with the maxillary central incisor, maxillary third molar with the mandibular third molar. Right? Because each tooth has two antagonists, the loss of one still leaves one antagonist remaining, which will keep the tooth in occlusal contact with the opposing arch and keep it in its own arch relation at the same time by preventing elongation and displacement through the lack of antagonism. The permanency of the arch forms depends on the mutual support of the teeth in contact with each other. When a tooth is lost, the adjoining teeth in the same arch may, depending on the occlusal forces, migrate in an effort to fill the void. You can see the figure 16.25. This is the figure 16.25. Illustration demonstrating possible migration, extrusion and improper contacts and occlusal relations following the loss of a mandibular molar. The migration of adjoining teeth disturbs the contact relationship in that vicinity. In the meantime, tooth movement changes occlusal relations with antagonists in opposing dental arches. The common result is hypercuspation of the tooth opposing the space left by the lost tooth. This is the figure 16.26. Showing the picture is showing the hyperapted third molar due to loss of mandibular third molar. Right now, it will be showing casts mounted in centric relation on articulators, showing undesirable centric relation contact of extruded molar with the lower molar.